So the benefits of robotic-assisted surgery are really it allows us to be very accurate through a very minimally invasive approach. So it combines those two factors, and that allows patients to heal a lot faster, get better quicker, use less pain medications. They're up and about walking the day we do the surgery. So it really changes that whole dynamic of the postoperative care of the patient. Is a very, very unique robot that is the first robot to combine two different technologies. So one of the technologies is called guidance or navigation. And what that allows you to do is see on a computer screen what's happening on the inside of the body. So even though I can't see with my own eyes down inside the spine, I can look at a computer screen on a 3D reconstruction of a CT scan and know exactly what I'm doing on the inside of the body by looking at that screen. So the robot provides me with a trajectory, and then I can place the screws down through the trajectory that it provides me and see live on a CT scan on a computer screen where that screw is actually going. So it allows me to be perfect in the placement of those screws. It doesn't actually perform the surgery, but it assists the surgeon. And so it will allow us to operate on the neck, the thoracic spine, and the low back as well. And primarily, right now, it helps us to place hardware. So when you need instrumentation in your spine to stabilize the spine, this robot will assist us in placing that hardware perfectly. And so now what I expect is a patient will come into the office. They'll usually have a combination of some back pain from arthritic changes or a traumatic event or something. And they'll have associated with that some pinched nerves. So there's something called stenosis, which just means there's not enough room for the nerve root, and the nerve root is irritated by that. And that can be caused by many, many things. Again, trauma or a disc herniation or something like that. And so when they have those two factors, it's incredibly painful, the back pain and the leg pain combined especially. And so if they have one or both of those, we can oftentimes take them to the OR and fix the problem. And with the technology that we have now, it's a much safer, much more effective procedure done with much less invasive techniques. This is some incredible technology that's going to really change spine surgery across the world. I really believe that firmly. And so it's great to be part of the very beginnings of that. So I'm grateful for St. Mark's. We've always had a very well-established group of spinal surgeons here who do really great work. And now we have the ability to do that great work better and less invasive than we did before.